Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy, virginiainstitute.org. You can also find archives of previous programs online at our YouTube channel. Go to YouTube and search Freedom and Prosperity Radio. Our first guest is perhaps one of the best researchers out there, and he's almost like a monk when it comes to digging into things and finding all the little goodies that are hidden in the nooks and crannies of these legislations, often in the case of climate, but in this case, healthcare. And we kind of follow up to a discussion we had last week on the program regarding healthcare and paying for it and going forward. He is Senior Fellow with the National Center for Public Policy Research. He is Bonner Cohen. Good morning, Bonner. Welcome to the show. How are you doing, sir?
I'm doing very well, and I'm delighted to be here.
I didn't want to oversell you, but you are that guy. If there's anything hidden in a bill, it's going to be found by you. You've been digging into House and Senate bills that are about trying to expand health savings accounts. First and foremost, I guess conceptually, it just bugs me that we need the government's permission to save money for something. But beyond that obvious hit, tell us what's going on with these.
Yes. For some time, of course, we have been in the midst of a debate over health care. This goes all the way back, if you want to take it back to Hillary Care back in the 1990s, to Obamacare. Now we have debates over drug transparency, Medicare for all, single payer, what have you. And right in the middle of all of this, there is something that many Americans use to help cover their health care costs. These things are called health savings accounts. Mm-hmm. And actually, they work a little bit like an IRA in that participation is completely voluntary. You can contribute a certain amount of money either as an individual or as a family into a health savings account. You can do that every year and let that money build up. So when an emergency comes along, you will have funds to cover that. Mm-hmm. Now, this program in 2011 had 6,300,000 participants nationwide. Now, that has grown to over 25 million now. Which gives us some indication of how popular the program is and how people realize, hey, wait a minute, this is a way to help fund things. We have a terribly convoluted healthcare system in this country. Mm-hmm. Most people's health care comes to them through their employer, but if you are self-employed or you work for an employer who doesn't provide that, then you have to fend for yourself. And so the whole thing is very confusing, but there's really nothing confusing about health savings accounts. So there is an effort on Capitol Hill now through legislation called the Personalized Care Act, and it would allow the annual contribution to a health savings account and this is a pre-tax savings. Mm-hmm. So again, it works a little something like an IRA, but it would increase for individuals from $3,550 to $7,100 a year. And for families, it would grow from $10,800 maximum annual contribution all the way up to $29,500. And what this would do, of course, is provide a cushion for people. Mm-hmm. There are catastrophic health things that come along, a terribly debilitating disease, or simply giving birth to more children. This all costs money. And here is a way to help pay for that. And the program is already on the books, and the legislation that's pending in both the House and the Senate would simply expand that, allow people to contribute more, and also allow people to use their money, because after all, this is their money. They contributed this voluntarily into a health savings account, and they would allow them, for the most part, to use that money as they see fit.
Bonner, what really has always gobsmacked me about this is when you look at the amount of money that's deducted from somebody's payroll, their paycheck, for health care insurance, their HMO cost. I mean, if we just could save 2/3 of that and then, buy, a catastrophic insurance policy, which, if I recall correctly, are not very expensive at all, we would be saving so much money. Not only, and this is what really bugs me about this, not only would we save the healthcare system, we'd put it back in the hands of the consumers, but we would also save Social Security and Medicare because you'd have so much money saved up by the time you got to your senior years that you wouldn't need Medicare.
Yeah, that's exactly right. This is a program that's been sitting out there, and for a while, received very little publicity because it kind of lacks the big sex appeal of Medicare for all or single payer, and of course, it has entered the debate over that. Now, let's be real honest about something. Medicare for all is really single payer. Medicare is a program set up for people 65 years or older. Once you get that program and you expand that to cover everybody, infants, children, teenagers, people in their 30s and 40s,
non-citizens,
there's no way in the world you can pay for it. So the whole thing is a pipe dream, and it's also a very dangerous pipe dream because once you start going down that road, you're going to destroy what is admittedly a very convoluted but far and away the finest healthcare system in the world.
Well, but isn't it also something that's patently unprovable? This is all driven on the fears of the unknown and saying, well, what if? And there's statistics that say a certain percentage of us will face those what if moments. I've had my own battle with lymphoma and that kind of thing.
Right.
But that being said, if you are allowed to hold on to these, and I was told that one of the other problems with health savings accounts is that not only are you limited how much you can save in them, but you're also limited to how long you can hold on to them, and the disbursements have to happen after a certain amount of time, so you can't save them up for your whole life the way you would an IRA.
Right, and of course that's something that needs to be addressed because here is an alternative funding mechanism that would allow people to deal with the problems of one that you had to deal with and countless other people have to deal with, either for themselves or for their children. Mm-hmm. And why not do it this way? Because this largely keeps the government out of this. In fact, the only reason the government's part of this now is that there is a tax benefit from putting your money into this, so this takes us into the tax code, and that means you have to have congressional approval. But all that said, if you just look at the other schemes that are out there for government takeover of the health care system, which is the moral equivalent of going to the Department of Motor Vehicles to get your health care system, we've already seen what a total disaster the Veterans Health Care Program is. Mm-hmm. And sadly, it hasn't been fixed. It may not even be fixable. So we know if we go down that road, it does not lead to a happy place. So why not do what we think? Why not do something mm-hmm. that puts your health care in your hands? You spend the money as you want to do that, and this is, I think, in the finest spirit of America. It does distinguish us considerably from the way the rest of the world goes about this, and I think could continue to make the United States the world's leader in providing quality health care.
Yeah.
That you can get operations here that you really can't get anyplace else in the world, and you can get them relatively quickly. The problem, of course, is paying for them, and these health savings accounts would certainly be one way to help us get from here to there.
Let me gameplay this out. Let's take the contrarian view. I'm going to be devil's advocate for a little while. Bonner Cohen is on with us from the National Center for Public Policy Research. He's got a great white paper on House and Senate bills trying to expand health savings accounts. All right, so I can hear the leftist in my head. I keep one there because it's where they're the safest, because otherwise they're dangerous to themselves. The leftist in my head, the first thing they say when they hear about this is people aren't responsible enough to save up this money. They won't do it. Not enough people do IRAs, so that's a bad thing to try to pattern this after. What is your point? What would be your follow-up to that?
I think as we look at it, the statistics simply don't bear that out. As word gets around what health savings accounts can do, and that's the current setup of health savings accounts, we do see that 25 million people are already engaged in health savings accounts, and that number is growing. And if we were to expand the amount of money that people can put into health savings accounts and give them even more freedom to do with the money they have in there, with what they think they need to do to take care of themselves and members of their families, you watch that number grow. It'll go to 30, 35, 40 million, just as over time, participation in IRAs, which also started out very modestly, not modest anymore. Mm-hmm. People not only have an IRA, they have more IRAs. Now, the left might be right in one weird sense. There are people who are irresponsible, but and they want to stand around and wait for handouts. Well, okay, that's a choice they make. And even for them, we have Medicaid for people taking care of people with lower income. To be honest with you, the quality of care there is not that good, although it's still vastly superior to that which you would receive elsewhere in the world. Oh, yeah. But there is another world that you can enter. And I think the left always says, well, people won't do that because see, the left is ultimately an elite. They know what's best for the rest of us. Well, as a matter of fact, they don't. And they have consistently underestimated the intelligence and the common sense of ordinary people about whom they actually know very little. And I think we would see over time that more and more people would get involved in health savings accounts, and that would obviate the need, the so-called need, of any kind of increased government role in the system, because if you get government involved in this, then you're going to have the son of Veterans Administration, son of DMV. It's going to be terribly bureaucratic, and the quality of care will plummet.
So the other leftist, the super leftist in my head, he's got curly white hair and he sounds like Jackie Mason, is saying, this is just for Wall Street. You're turning over our healthcare system to Wall Street because it's an investment vehicle. And I'm not making this up, because I think you and I remember, Bonner, before the September 11th attacks, that was the most controversial thing about the George W. Bush administration, was he was trying to do something similar to this with Social Security. And everyone on the left was screaming, Joe Biden included, that he was just trying to turn Social Security over to Wall Street and a big boon for the Wall Street investment bankers. Talk about that, because that would be the follow-up argument of the super leftist.
Yes, and it has no validity to it whatsoever, because in health savings accounts, yes, the money is invested because you want the amount that you contribute into your account. You want that amount to grow over time so that it can take care of the emergency that may, in fact, come along several years in the future. Well, this is the same thing we have seen with IRAs, just to cite the example. And you just look at that. Over time, they have risen steadily in value. Yes, there are fluctuations, but if you look at it over the long term, where are people with their IRAs today compared to where they were 10, 15, 20 years ago, when the Dow was much lower than it is now? So, yes, it could well be that certain people on Wall Street would benefit from this, but the real beneficiaries of this would be the people who would have that reserve fund at their disposal, into which they can reach when unfortunate things come along, as they invariably do in life, and it would be there. And if somebody on Wall Street makes money on that, who cares? Because the real beneficiary of that are just ordinary people.
Well, and that's what I think that the sad thing is that you've got government elites that, as you mentioned, Bonner, are so hell-bent. So take us into the proactive of this. So you've broken down what the House and Senate bills are trying to do. What's the prognosis, Doctor?
Okay. Prognosis for this year is not good for the very simple reason that the legislation we're talking about has nothing but Republican co-sponsors in both the House and the Senate, and the two bills are absolutely identical. And without Democratic co-sponsors, particularly in the House, it's obviously going nowhere, and the Republicans do not have a filibuster-proof majority in the Senate. So right now, this is purely symbolic, but it's an important symbolic debate simply because it compares. All right, do you want the government taking over your health care system, or do you want yourself to be in charge of taking care of your and your family's health care? So this year, both bills will go nowhere. Now, depending on the outcome of the November election, about which we can only speculate, but if purely hypothetically speaking, the Republicans take back the House, then and keep the White House, then I could well see health savings accounts being front and center next year. Mm-hmm. And when I say health savings accounts, I mean the expansion thereof. Mm-hmm. And so this is something that's very good for us to have a debate about this now, so that more and more people can find out about these things, and so that when the political landscape has changed, as well it may, this could become a real option for people.
Well, and for those listening to us in Virginia, you have many, many seats, 7th Congressional District, 10th Congressional District pop into my mind, where there are nominating processes underway, heading up either to convention or primary, depending. Most are convention, where this could be an issue amongst those who are seeking the Republican nomination, never mind becoming a General Assembly or a general election issue. As well, coming up in 2020, we do have a Senate race, but we do have a GOP majority in the Senate right now. But I certainly think it's a fair thing to point to and say, can this be a topic? Can this be something brought up? Because we've seen in the Virginia General Assembly just this past week, you can pry some Democrats away from the bags of money that have purportedly put them in their offices and to which they supposedly are sworn bloodless fealty. And so it can happen. I'm not sure it's going to be easy, but these are the things that need to be brought up. Where can people read more about this, Bonner? At nationalcenter.org?
Yes, nationalcenter.org. And the article I wrote about the legislation was actually published by the Heartland Institute, which is heartland.org. And you can check it out there, or simply Google my name, Bonner Cohen, Health Savings Accounts, and the article explaining the program in detail will pop right up.
It's one of those things that I just can't figure out how we don't get out of the way of it. But then again, we live in a world where in Virginia, the General Assembly had to give farmers permission to sell the produce that they grow on their farm. So,
and this is a right to farm state.
Yeah, exactly. You just can't sell any of it. You can grow all you want. I guess that's what Michael Bloomberg meant when he said, "I can teach anyone how to farm."
That's right. Well, you learn a lot about farming growing up in Manhattan.
That's right. Well, considering he's like a manure machine. But anyway, I digress. Bonner Cohen, thank you so much, sir. Best to you, and hope to see you at CPAC coming up very soon.
You will see me at CPAC. I'll be there.
Absolutely. Thank you very much. Coming up next on this edition of Freedom and Prosperity Radio, contributing editor to Bacon's Rebellion, senior fellow with the Thomas Jefferson Institute for Public Policy, Steve Hayner, coming up with an update on the General Assembly this week on Freedom and Prosperity Radio.